Lab Experts. In today's episode, we are going to be talking about HIV-1 testing in babies using geneXpert technology. And in order to be able to discuss this topic, we have a medical laboratory scientist with us. His name is Marvelous Gebefumwan. How are you today, Marvelous?
Good evening or good day. Good day,
Good
everyone.
day.
My name is Marvelous Gebefumwan. He's a Chadian, so he will not. I pardon him. I pardon him for murdering my name.
I, I,
Everybody always has
I thought you,
difficulty pronouncing my name, Shabon.
yeah.
Yeah.
I even have a Nigerian with me that was having difficulty pronouncing your name. So it's not only Chadians.
Okay.
So
Fine.
tell us a bit. What do you do?
Okay. Currently I'm an intern. I'm doing my internship at University of Benin Teaching Hospital in Benin City, Edo State, Nigeria. So far, I'm almost done. So
Okay.
I'll be done in October. 1
Oh,
year
really?
compulsory internship.
So in what, 2 months? So how does it feel to almost be done?
Relieving, sure. Relieving.
Yeah. So what do you do there? What does your day look like over there?
Okay. Routinely, the way it is, I don't know. I'm sure you're med lab scientist, so I'm sure you know your internship. There are various units
Yeah.
in MLS. We have hematology, blood transfusion science, clinical chemistry, histopathology,
Yeah. So you
and
cycled
medical
through
microbiology. So we are
every
posted.
unit?
Yeah, we cycle through every unit. You get to learn, work,
To date,
medical microbiology.
and to date, which is your preferred section? What did you like most of all the sections?
Okay, my specialty is hematology and blood transfusion science.
Okay.
But it's honestly it's my least favorite because of the workload.
Yeah.
Thank God. Thank God. As a med lab scientist, you're a med lab scientist. You don't just focus. You should be vast in all the areas.
Yeah.
Even if you specialize in one area,
You should be conversant with the others.
You should be conversant with the other.
So our topic today is HIV-1 qualitative early infant diagnosis. Why did you want to talk about this topic? What interested you about it?
I think during my posting, it was one of the few tests that I got interested in him, and I think I'm conversant enough to be able to share it. Because, I was able to apply it to the point where I can share it. So that's why I chose.
Was it hard to
Generally,
get it?
PCR is one of the aspects of MLS that has interested me so far, but there are other tests that are a lot more complex. I would not want to shoot my leg in the foot and come and talk about something I'm not very familiar with.
So, do you get a lot of cases of children that have been affected?
Yes, okay. Let me just summarize it basically. So we have, people living with HIV. It's possible for them to have children without HIV. So this is like is a way to make sure or gauge the effectiveness of this program. So there's also a form of prevention and care for the patient for maybe a child who probably is because the parent is living with HIV is prone to having this infection. But if the doctor has placed the parent on a regimen or a program to prevent the child from having it, this is a way to ascertain because for these early infants, before you can start using a LISA because the infection is still new, it's still in the early stages. There are no antibodies
present
on ground for you to detect it. Using a LISA means what we are more concerned about is the antibodies, but they're not there, and so you cannot detect it at that early stage. So you have to use this PCR technique, the nucleic acid test, to get the viral to detect the virus in the patient. So you're not after the antibodies, but the virus itself. And usually from the age of 18 months, we are able to detect the virus in this patient for babies that are less than 18 months.
All right. So you've been talking about detection, not quantification. So what you are trying to do usually is just ascertain presence or absence.
Yes,
You're
yes.
not really trying to determine
The
the
qualitative
quantity. Okay, so it's just a
the
qualitative test.
qualitative.
Yeah.
Yeah.
Does it also allow you to do quantitative if you want to?
Okay, that you have that would be viral load.
Yeah.
You can also do viral load. Use the PCR technique to get the viral load for
Mhm.
patients. Patients living with HIV, you have to monitor their viral load, so that you can when they take antiretroviral drugs and it's supposed to like knock down their viral load. So
Yeah.
if I think once every 6 months or yearly they do the viral load test to know the quantity that they have. Then if it's not up to a threshold or a particular level, they have to change their drug. So that's why they do that. It's also you can also do a PCR technique for that, but this
Yeah.
is quite different
Okay.
because this you use. I don't know if you're familiar with the geneXpert. The geneXpert is more of a closed system. You have a cartridge.
Mhm.
I think you have a cartridge that has the internal control, the probe, everything inside, the reagents and everything inside. So all you just need to do is to um, put your sample. So I think we'll go through.
Yeah.
Let me not present myself. We'll go through the whole procedure.
All right. Now, when it comes to this, so for you to be able to test the child, that means that the mother has been followed for a while. Now, before we get to the child, for the mother to be followed, in because there are some people who, when they don't really want to get tested, they may not know that they have the disease, or they may know they have the disease, but they may not want to necessarily go and see a medical doctor and then be monitored all the time. Maybe they'll be scared that people around are going to find out. How usually do they convince those people to come and get tested?
It will be for a person. I think at this point in time, we all know that people living with HIV can actually live normal lives if they continue to take their drugs. So it
Mhm.
should, and these drugs in Nigeria is free. I don't know
Okay.
about other places, but it's free. And they should. It's not advisable. You just be doing yourself a disservice if you're I think what most people do, you be doing yourself a disservice if you don't follow, if you're not seeing your doctor regularly to know your viral load, seeing a counselor. There's a whole program. I
Yeah.
think that is PEFA. There's a PEFA program for people living with HIV that they go through. They have counselors. You have to see your counselors regularly, and they
Mhm.
would help you. Yeah, make sure that you take these drugs
Yeah.
regularly. So it's not and even for like for you to be able to do this coming to this test. This is for maybe a mother that is living with HIV
Yeah.
and is already on the program already, and the doctor is trying to make sure that okay, this child does not have HIV. We are doing a test. Okay, have we successfully for the doctor has the doctor successfully done all that is required to prevent this child from having it. So the whole system is geared to helping this patient. So
Yeah.
I don't think it's
All
not
right.
advisable. It's not
Yeah.
advisable.
Yeah. So they need to go to their medical doctor to make sure that they can actually be followed, they can be monitored,
Yes, there's a program for them. There's a
so that
program
they
for
can
them.
get better.
A
Yeah.
working program.
And when it comes to payment, is it free? So you said the drugs are free. So that part,
There's the
how
drugs
about the
are
testing?
free.
Testing
Even
also.
the viral test is also free.
Now, when the patient shows up, what happens? How is the testing done? Maybe let's start with sample
Okay,
collection.
okay. For this, we have there's a filter paper. There's a filter paper with circles, and that's where the dry blood spots. So that's where the dry blood spots is. You put okay, they are babies.
Yeah.
They're babies, and you might not be able to get like whole blood from them,
Mm-hmm.
because they are most of these children are less than 18 months. You can't
Yeah.
get whole blood from them, so you can do a finger prick, and then there's a filter paper
Yeah.
where it's about 12 millimeter. You're supposed to absorb the blood.
Yeah.
The blood will be absorbed on the pizza paper. Um, I don't know if I have. Okay, I don't think I have a diagram for that, but I have other diagrams um, for that in the circles. At least, but there should be about. You should be able to like spot about the minimum of 2 circles. There are about five circles for each patient. You should spot about 2 circles,
Yeah.
and if it should cover the whole circle, and the it's also it's calibrated. If I can use that, it's about 60 to 70 mils for each circle if you fill up the whole circle, and that's what they put it. There's a desiccant inside in a resealable, okay. There's
A
a
pouch.
resealable pouch, yes, where you put the filter paper, and
Yeah.
then there's a desiccant inside to make sure that it's not it's dry,
It
it's as
dries up.
dry as possible.
Yeah.
That's what you take is dried up. You put the patient's information. You can also use whole blood, EDTA whole blood. But most times the samples come in this filter paper that has been spotted, or
Yeah.
dry blood spots that have been spotted. So they send dry blood spots to the lab with the
Mm-hmm.
patient's information. Then the technician or the person receiving the sample would go through and make sure there are at least two blood spots. Can be three, four. Usually they just try as much as make five good spots because you might have usually when we store our samples when we carry out a test we store it for future use. So you just need one
Yeah.
good spot, but then
Just in case.
we
Yeah.
get to store, yes, just in case we have to repeat the
Yeah.
test. There might be cause for us to repeat the test. So that's how the sample
It's
is
collected.
collected.
All right. The sample is collected. So then you take it to the laboratory, you do your testing. What are some problems that you might face during that process?
Okay, I think a cause for sample rejection would be if blood spots is not. Sometimes they're just it's not. There's a circle. It's a circle, and you're supposed to like fill the whole circle. For some
Mm-hmm.
persons, because they might some reports will be like, the child is anemic, you could not get enough blood and all, but it's supposed to be enough. It's supposed to be at least 60 microliters or 60 to 70 microliters. So you have to fill the whole 12 millimeter diameter.
So
That's
essentially,
usually the
is
content.
not enough. The amount of sample that was absorbed
Yes,
to the paper is not enough.
sometimes yes, it might not be enough.
All right. Now, one
Okay.
thing
The
yeah,
the name. Let me just point out the name of the filter paper is Wattman 903 filter paper.
you said what, man?
Wattman 903 filter paper. There
Okay.
are other equivalents though, so
Yeah.
usually we use that.
Now, the geneXpert technology, aside, so you said there's geneXperts. So, in some cases, let's say if the infection has been around for a longer period of time, you can detect antibodies using ELISA. Are there
Yes.
other platforms aside from geneXpert that can also allow you to do this sort of qualitative testing, like
Okay.
similar
The
platforms
geneXpert,
where
the
everything
geneXpert,
is incorporated?
the geneXpert is a PCR machine, and there are other types of PCR machines that. But the geneXpert usually is a closed system. So you have a cartridge for a specific test. You also use geneXpert for TB. So
Mm,
we also use geneXpert for TB. But generally, PCR technique is broad. Is broad. When you're doing viral load for HIV, we also use PCR, and most times not is not with this not with the geneXpert. You can use other forms of PCRs that will be able to give us can quantitatively um, detect this virus or any other virus, even COVID and every other.
and you get a
This
lot
one
of
is a closed system.
Yeah, and you get a lot of tests of this sort. So when you were
Yes,
doing
yes,
this,
yes, yes.
was there a large volume, or what did it look like?
No, okay, no, no, not a large volume, but regularly. Yes. Let's say for a day, and because of the hospital I work in, it's a federal hospital. and it covers the whole state as it
Yeah.
were. So we get at least 5 samples a day, thereabouts,
Okay.
5 to 10 samples a day.
5 to 10 a day. All right, I see. And that's all from people who are parts already being monitored, so around the state. So are there other places
Yeah.
where the testing is done, or is it like a hub and everything is sent there?
Yes, even for the viral load, I think we receive samples from all over the states,
Okay.
from patients for patients living with HIV. Receive samples from all over the states. But for this early infant diagnosis, most times the patients are in the hospital. They are quarantined. Maybe the mother is delivering in this hospital, so you just send the sample
Okay,
to the
so
hospital.
it's like they take the sample sort of right after birth,
Yes, immediately after.
and then it's being sent directly to your lab in order for you to do the testing.
Yes, exactly.
And they expect usually to get the results within what time frame?
Okay. Well, to carry out the test, once it's sent to the lab, usually a day. It will take a day to, but the whole process of the turnaround time is usually one day.
Yeah.
Let's just
Okay, so
turnaround time.
yeah. Okay, so it's not that long actually. So
No, it
essentially
takes
from birth till the person gets the result, it could be about a day, maximum 2 days.
yeah.
And in cases where you may have to, so earlier on you said you do the testing when you're collecting the sample, you are getting 5 blood spots usually. So in case you may have to do replicates because of one reason or the other, what are some reasons why
Yeah.
you may have to do some replicate testing? Why you may have to recheck
Okay.
results?
There are some times where you carry out the test and you might have your results. You might have an invalid result. You might have an error result, and there are reasons for those things. And then you have to repeat it. So those are some of the reasons.
And how do you catch those errors? So apart from
Okay.
invalid,
Yeah.
so if it's invalid, I guess the machine tells you it's invalid for one reason
Yes,
or
it's
the other.
invalid. The machine tells you.
Yeah.
Yeah. Let's say you carry out a test and the results. You see the results. It can be invalid. It's right that the test is invalid or there's an error. During the probe check, found out that it was not the sample. The volume was not enough, or so the machine has quality control in
Inbuilt.
to yes. So if that happens, you may have to like repeat the test again. So that's why
Yeah.
you have.
And I assume in your case, you don't deal directly with the patients, right? All you
Oh
do
no
is
no no.
you send the results back to the medical doctor, who is then going
Yes,
to be in
exactly.
charge of discussing with them along with counselors if necessary.
Let me see if I can show you. Okay, I wanted to show you some pictures, but it says only the host
Okay,
share.
actually, let me just open that. Okay, you should be able to share now.
Okay, so this is the geneXpert machine.
Yeah.
Let me see if I can share. Okay, so this is a thermomixer.
And what do you use that for?
Because now when you get this sample,
Mm-hmm.
there is a sample reagent. Usually for each cartridge, there are about 10 cartridges in each kit. I said that the geneXpert has cartridge.
Yeah.
So there are about 10 cartridges in each kit. And we also have like a sample reagent. The filter paper is perforated. You're able to break up the dry blood spots and insert it into the sample reagents.
Yeah.
Then when you insert it and you cover it, you put it inside this thermomixer, and the thermomixer heats at 56 degrees Celsius and rotates at 500 revolution per minute. And
Mm-hmm.
this is so you leave it there for about 15 minutes. Then you take 1 ml, the liquid.
Yeah.
That's the liquid the sample reagents plus the dry blood spots. You take 1 ml. After you put it in the thermomixer for about 15 minutes, take 1 ml and insert it into the cartridge before you put it inside the geneXpert. All this you do in a safety cabinet. Let me just show you. This is the process.
Mm-hmm. All right.
So this is the cartridge.
Mm-hmm.
has a processing chamber, patient to barb body sample. Okay, this is where you put your sample. That's a 1 ml pipette.
Yeah.
You take 1 ml, the sample reagent has been soaked inside. So you put it there, and then yeah, it's with the geneXpert machine. Okay, so those are some of the pictures that I have. Let me see if I have any. So the materials that we have. So in
Yeah.
each kit we have like 10 assays cartridge, and in the cartridge they have lysis reagents, rinse reagents, elution reagents, then also the sample reagent that I talked about, the disposable 1 ml transfer pipette
Pipette.
and disposable. That's about it.
All right. Thanks a lot for helping us go through the process and then understanding this a little bit more. Is there anything else you think you want to share with the public?
I think that's about it.
All right. Thanks a lot for taking the time to actually show us how this works and how it functions. So yeah, it's extremely important for people to understand, like you said at the very beginning, that HIV is a disease that today that doesn't kill like it used to in the past. There are drugs, you can be helped. So as a result, you need to go to your medical doctor, you need to get checked, you need to make sure that even aside from just HIV, that you get tested every once in a while to assess your health, so that you know what needs to be done, because there are lots of situations where you might know people around you who seemed fine, and then all of a sudden you find out that no, they had this or they had that, and as a result of that, they died. So it's important to have your health checked. It's important to always make sure that you discuss with health professionals and make sure that you are fine. Now, if you're infected with HIV, you also need to make sure that you have your children checked, and that's what we're talking about today. So at birth, there's a way to be able to determine if they have been infected or not, so that they can be treated very early, so that things can be a lot better for them. It's not nice to, how do I put that, for the sins of the father or the mother to be transferred to the son or the daughter. And so we need to prepare and stave that off as much as we can. Thanks again for helping us navigate through this. If people want to get in contact with you, how do they do that? Through LinkedIn or what platforms?
Okay, LinkedIn, Twitter,
Okay,
at
Twitter.
Gurumar, Gurumar.
All right.
Twitter,
All right.
Mav, Gigafre.
Thanks a lot for being here with us today. Hopefully in about 2 or 3 months, you'll come and talk to us about how your interview process went through and then how you found your new job.
Amen.
We want to hear about that. Thank you and see you next time.